If others join us, that's fine. We're going to be pretty quick. The purpose of this conversation tonight is just, it's pretty simple. I wanted to get a feel to see how folks in your field or genre or area of work, how you are managing the COVID crisis. And then we want to talk about vaccines. And I will let Ms. Boswell talk a little bit about some things just to give us an update as a community so we're all up to speed. And I'll try to share with you what I'm trying to do from the mayor's office as it relates to equity and vaccines, which is really where I see the focus of the immediate work for the mayor's equity initiative. It is on making sure that the vaccine is equitably distributed to as many people as possible. So Matt, why don't you just tell us a little bit about how you guys are managing COVID and any other issues or ideas that you might have as it relates to the community and COVID, but from the Public Defender's Office, how are things going?
Yeah, so thanks so much for having me, Mayor. I'm Matt Metz. For those of you who don't know me, I'm the elected official for the Public Defender's Office. We cover all of Volusia, Flagler, Putnam, and St. John's. And so the Public Defender's Office, we care for every single person who's charged with a crime who can't afford a private attorney. To that end, we end up having somewhere around 35,000 criminal trial cases throughout the Seventh Circuit every year. And this year has obviously been exceptionally different. COVID has caused the court system, while not to come to a complete halt, it's really slowed us down. I've just elected recently in last August, and during that time period, I still had a caseload. That caseload went anywhere from 100 to 120 at any given time. By the time I actually handed my caseload off to somebody else, it was at 180, and it wasn't uncommon in my office to see caseloads go up to 200. So anywhere approaching double the average number of cases we usually have. It's a number of factors are occurring there, but the ones we really have a problem with is that there's no jury trials. So, and kind of an overview level, jury trials are what really push the criminal justice system along. Everyone hears about plea agreements and how most people end up in a plea, and while that's true, it's the threat of trials, both from the defense and from the state attorney's office, that really push everyone into agreeing. If the state attorney's office doesn't have a particularly strong case, we can threaten to take a case to trial, and they have to look at that possibility of losing everything. And at the same time, when the defense has a strong case, when the state attorney has a strong case, the defense is threatened with, if you go to trial, you may have a really bad outcome. Losing that ability to go to jury trials regularly has clogged up the system. At an internal level, it's also affected how we practice. Our attorneys, we're not allowing them to come in every day, but we want them to come in enough to make sure that they're meeting their obligations ethically. So we're having to balance right now because the COVID infection rate was relatively high in the last month. I only had them coming in once a week, and we're blocking it in schedules so that we don't have too many people at any given time. We're also making sure we try to follow through with safety procedures, not having people congregate in offices, everyone wear masks when you're not in your office, as well as having alcohol and sanitizer readily available for people to use. But at the end of the day, this is still tough for people who are used to being sociable. You have lawyers who have type A personalities, and trying to tell them not to talk too much to each other is not an easy thing to do.
Okay, well thanks a bunch. We'll move down. Courtney.
Yes, sir.
You want to tell us a little bit from your perspective or things that you've seen in the community or even in your work world? I know you work with Matt and for Matt, but if you may have something else to add, feel free to do so.
Yeah, I definitely agree with Mr. Metz. That's kind of the tough part, the not being able to be as sociable, because, and not even just being type A attorneys, which a lot of us are, but just that camaraderie that we have of like, oh, hey, I got this issue. Can I come sit down and talk with you about this issue? So it's a little bit difficult and having to get used to, just sending an email or even calling from office to office or picking up the phone. From a community standpoint, it's a little different for me because, well, obviously I do a lot in outside the community, dance, cheer, different other kinds of things. And that's unfortunately has slowed down a bit, and trying to make sure that we're still able to have things for like the children, for example, because a lot of them, it's affecting them a whole lot because they're used to going out, exercising, or being with their friends. But it's really hard trying to come up with safety precautions to make sure they're able to still participate, but also, still keep their camaraderie among each other. So, like, for example, with the cheering, that was a lot to handle. Of course, we did the sanitizer, wearing a mask, even being outside and things like that. But it was kind of hard to, on water breaks, stopping them from hugging each other and things like that. So it's just kind of been a challenge of trying to balance, even in the community, of being able to help people and assist like you want to with everything going on.
Well, I'm glad you mentioned that because, I have had of late, and a part of this conversation is going to be about, COVID and transmission. And, what we were learning is that children are not, and, I work in the school system as a school-based administrator, and I'm watching children interact on a daily basis. And overwhelmingly, they do wear their masks as best they can, but they are in each other's faces, and they interact naturally,
Right.
without COVID. But we don't see the rates of transmission being as great among children as adults. Because I can tell you, I watched them in the cafeteria with 300 of them, and we've had, a very limited amount of cases involving children. But with that being said, I say all of that to say that I've been of late thinking about how we begin to return some things to normalcy as it relates to the city and as it relates to things like parks and recreation. How do we now start to really think about, what are some things that are activities that are reasonable? One for us has been swimming. It's been pretty stable and steady because it is outside. And, we want to try to keep things that we can control as a staff. But I'm hearing from adults and parents and families that they are getting a little frustrated with us having our facilities closed. Recently, we did allow practices at our baseball fields. And so now I'm thinking about what do we do moving forward in the summer? Should we start to allow, because we're missing basketball season right now. Should we perhaps go back and allow our Parks and Recreation Department to execute a basketball program or soccer programs that we've missed because our children are in need? But I don't want to, I've prided Daytona Beach on being a COVID responsible municipality. And it's been something that's, I've pushed to a lot of chagrin by a lot of people. But what are you hearing in the community? Do you feel that there's an appetite for activities among young people? I have had some senior citizens, who have asked us to reignite our Senior Oasis program, and I'm having a hard time because our senior citizens are the ones that I have to protect the most. So I'm just like, I'm not going to do that. We're not going to start back playing bridge, but then, I'm having attorneys here. Will we be accused of some form of community discrimination if we begin to open things up to children and we refuse to do the same for senior citizens? Any thoughts on that?
Courtney, I'm not sure how you feel about that. What I've definitely found in the community is that you do have a dividing line, and it seems to be pretty hard. You have a lot of people who want to live with the risk and understand kind of, there's been a lot of information coming at us, and a lot of it's changed over time. I think people feel more comfortable taking out, wearing your mask, trying to stay apart, but trying to live as close to a normal life as possible. On the other side, you have folks who really still think or hope that we can completely maybe do something almost New Zealand style, where we shut it down for a time period, everyone stays completely apart for a while, and then try to eliminate it that way. It seems hard in such a diffuse society to go that route. But it also seems, at some level irresponsible to completely go back to the way things were. I think you're going to find, and you probably have found, a lot of people taking some self-help to that extent, doing a little bit of what they want to do. And that's certainly what I've seen, in the communities, people starting to go back to living in a slightly more cautious but usual way. I don't know if Courtney's had that experience as well.
Yeah, I agree. It's the same. Because even bringing it back to like with us in our job, it's so hard now, having client interaction because you're so used to being able to sit across from them at the jail, and that makes you more personable and things like that. And they essentially want to shake your hand and things. But then you see some of the private attorneys when they come in, they're, close to them and they're doing those things and like that. So kind of going along with what you said, some of them returning back to that level of normalcy.
Mhm. Okay, well, thanks. Welcome, Chief. It's nice to see you. We're just having a little introductory and conversation about each individuals, discussing a little bit about what they're doing in their department, how they are, or their area, how they're responding to COVID in their work world. And I'll let you answer that. And then I would also like to get your feedback on the question that I just asked, which is, as I begin to consider opening certain things up, like parks, which our parks are open, but doing some things as it relates to parks and recreation, maybe basketball or soccer. What are your thoughts as it relates to that and as it relates to COVID, but primarily, how are you guys managing this particular season?
Okay, so can you hear me okay?
Yes, sir, just fine.
All right, so first of all, good evening to everybody here on the Zoom call. I tuned in a little bit ago, but I was the blank iPhone, so
Okay.
I've been listening in for a few minutes. But as far as the police department goes, we've definitely been affected by it. Obviously, we've never had the luxury of social distancing. So we've been in this from the beginning. So we've had approximately 150 officers that have been affected by COVID in one way, shape, form, or fashion. Either they have tested positive or they've had to sit out for a period of 10 days because of a close contact, whether that be a coworker, whether that be a family member, so on and so forth. So that's a rough estimate. We've had about 150. I have pretty much my entire narcotics unit that should be back to work on Thursday that have all been out for the past week just on a close contact to one particular detective who tested positive, and he got it from his wife. But I will still count it as a blessing because of everybody that's been affected by it. We haven't had any officers die as a result of COVID, because when you look at other agencies around the country, NYPD to be specific has lost 48 cops to COVID death. LAPD has lost about 8 or 9. Even closer to home, West Palm Beach Sheriff's Office has lost 6 to COVID. So for us to be able to deal with it, have the positive cases come up, but still be able to effectively staff both day shift and night shift. It's been a little bit of a challenge, but on the whole, I'm just grateful because I haven't had to hand a folded flag to a family member of an officer that passed away due to this COVID-19 virus. Obviously, we're a couple weeks out from Bike Week, and I'm gonna be honest with you, I'm extremely nervous about how we're gonna fare during Bike Week, because as we all know, this is the 80th anniversary. But I will say I support the decision to move forward with it. We just have to be, precautious. We have to continue to mask up. And I have a plan in place, a safety plan for my officers in my department that hopefully will work. I'm confident with it because we did it last year during Bike Week when we ended up shutting down in the middle, and that was using our drones to kind of help monitor Main Street. For example, what I did was I paired up my officers into groups, and we basically established a perimeter around Main Street. We established a perimeter around the M&B venue, and we do that to avoid the officers mixing through large crowds of people that were on Main Street and on M&B. And instead, I put my drone up, and I just kind of used the drone to help, conduct surveillance of the crowd as a whole. And then if there was an issue that arose that required a police response, then we could go in and just kind of be more surgical in our approach to dealing with whatever the issue was. So it's kind of like a get in and get out type of a mindset versus just having my folks out there in the middle of the crowd, saturated in the middle of the crowd for the entire 10 days. So yes, we have the safety plan in place this year. And we're just moving forward, and I'm just hopeful that we can make it through without having a bunch of folks come up positive 2 weeks after this thing, and then, have my staffing, being affected. So as far as staffing, what I've had to do is I've had to get creative. So I have different units. I have my detective division. I have my crime suppression team. I have my problem-oriented policing unit. And if I'm hit on a particular shift with maybe 4 to 6 cops that are out either testing positive or just a close contact, then what I have to do is I have to pull from my detective division or my crime suppression team or my problem-oriented policing unit and make them supplement patrol. But I'm just blessed that I have the numbers that I've been able to do that, so that, we don't have, we have enough officers to service the calls for service as they come in. So on a whole, I feel like we've been really blessed. I've been encouraging those that are willing to go and get the vaccine. I know that's a touchy subject in itself. I don't have a number of how many have gotten vaccinated, but I can tell you we've had both Advent and Halifax reach out to us specifically as first responders and offer us the vaccine. And I know I've had quite a few officers that have taken advantage of it and have been vaccinated, but I just don't have a number of, specifically how many have been vaccinated, because just like the rest of the country, you have the split. You have those that, feel one way about it, and you have those that feel another way about it. And it's just a touchy subject, so to say. So, that's not something that I've really done a deep dive on as far as who's gotten it, but I just encourage them to get it, even if it's not for themselves, it's for their parents and their grandparents and their children, so on and so forth. So I know I just threw a lot out there, but that's where we're at from the police department side.
Well, that's perfect. That's perfect, and I appreciate that. Now, what are your thoughts as it relates to getting back to some sort of activities? Are you hearing anything in the community as it relates to young people and their activities?
I think it's time. I think if we move forward like we did with Bike Week, and we put some form of a safety plan in place. I mean, it's easy to throw that out there and say that without getting into the logistics of what that plan would be. But I feel like we're at a point now to where moving forward into the summer, I would feel comfortable opening up some things. I would feel comfortable opening up the gyms. I would feel comfortable moving forward with football practice leading into, a Pop Warner season in the fall. I think we're at that point. I would feel comfortable with it, from our standpoint.
All right. Thank you very much. And I'd like to introduce everyone, if you don't know, Patricia Boswell, who runs our health department here. She's going to share quite a bit of insight with us, and I would also like for her to sort of opine on my deliberations and my thoughts and concerns as we move forward. I'm getting a lot of pressure to start to open things up, and I understand that. I have children at home who I'm anxious to have them do things that, that they need to be doing in order to live, a productive life and to keep their parents somewhat sane. And they're going on a year now of almost no activity. And, you know, my son is doing certain lessons online, piano lessons, and doing like an acting class online, which is really, those are working well, but he needs to be able to run out. And I saw a kid today, and this is off the subject, at school, and he has been home. He just came back to school today. And he must be in the seventh, eighth grade. And I assure you, he probably picked up 40 pounds from being at home. And when I saw him today, it really made me think, you know, and I even had my own son, you know, we've been out running, and I noticed how much he could run, or how much less he could run from 3-4 months ago in terms of his stamina and his wind. So, you know, that concerned me when I saw this kid who gained, I assure you, it was 40 pounds. So much so that I went over and had a little talk with him and said, you know, last year you were a tailback. This year I'm going to have to put you on the offensive line. And I say that, you know, to say that that is a concern also. And as one who runs has a mayor's health initiative, and that's very important to me, you know, a part of the way that we beat back COVID as a society is that we have to be healthier, and our weight needs to be down. So I'll go ahead. I'm sorry, Patricia. This just brought a lot up in my head, but Patricia Boswell, would you share with us a few things?
Well, no, thank you for that. I think we're seeing that across the board with weight gain and depression and different behaviors that normally, you know, we wouldn't have been experiencing. So I'm Patricia Boswell. I'm here at the health department, and I'm going to go back to the conversation around youth sports since and kind of go out of order than what I've been doing during these focus groups, because I normally go over the data and the vaccine. I'll save that towards the end, because I want to follow up on a number of things that were said, and I think it's timely to do it at this point in the conversation. So CDC has some great guidance on youth sports. They also have their science reports. They're called MMWRs, and I think it was released last week. But they had a really good study on wrestling teams in Florida. I think there were 10 teams involved in the spread of COVID. So what we know is COVID is like a hitchhiker, you know, just waiting to jump on and infect someone. But inside really tends to be more problematic than outside. So when you think about the indoor youth sports versus the outdoor youth sports. And also you want to think in mind, as we go through these seasons, we're going to go from spring to summer when most people want to be indoors in Florida, just the opposite of what's happening in the rest of the country that have, you know, sub-degree temperatures. So the outdoor activities are less risk involved than the indoor activity. So keep that in mind. And certainly my environmental health director, Robert, he can work with your staff in making, conducting some assessments when you're thinking about returning to some of these activities that will help in your decision making and how you can go about it. So I want to share that with you. Certainly the idea of Bike Week brings back the memories of last year. And one thing that really helped us was one of the visitors actually stopped in St. John's at the hospital and was hospitalized and never made it to Bike Week because they were infected with COVID. But the people they were traveling with, we were able to quarantine them before they actually got to any of the venues. So I remember checking on this particular group that we had down in New Smyrna Beach at one of the hotels every day to make sure that they weren't going out to Bike Week. The thing about Bike Week and the races is most of the people that are attending these events are coming from someplace else and then taking the infection back home or bringing the infection from someplace else into our community. So very often we might not even be aware of some of the cases because it might be 2 weeks after they've been here and they're home and they're getting tested and whatnot. So that's another thing to keep in mind. We don't get a real good handle on the type of spread that happens because it's not all involving our residents. So when it comes to vaccine, so COVID, and I think Matt made mention of it, things have changed. There's so much still unknown about COVID. Things are going to continue to change as the science becomes more and more aligned to what we really need to know about COVID. We're going to make more changes to this. And I think with vaccine, I would frame that as unpredictable. So right now we're dealing with the supply chain and it's very unpredictable. Not sure if AstraZeneca is going to be a vaccine available to us in any short term. 2 weeks ago, I was saying, oh, well, we're going to get Johnson & Johnson and we're going to follow up with AstraZeneca. So again, it's pretty unpredictable. So right now, the good news is we're expecting to see more production of the Pfizer vaccine. The Florida vaccine, now this is amazing. This is for the state. Our weekly allocation from the federal government just increased from last week to this week from 260 to 350,000. So when I say limited supply in a state of 20 plus million, and we're getting a weekly allocation now that of 350,000, and before that it was more like 250,000. So Volusia County receives an allocation of 4,300 at the county health department. Our hospitals have received allocations. They received allocations before we did, and then they stopped receiving allocation. This past week, Advent Health Daytona received 500, Halifax didn't receive any. So again, unpredictable in terms of what the local allocation is going to be. With the 4,300 that the county, well, it was allocated for the county health department up to 2 weeks ago, and they gave 2,000 vaccines each week now to 22 public stores. I applaud that. It to me, that's 22 locations that our residents can get to. The fact that the supply is so limited, again, you have a lot of frustration, a lot of impatience, and a lot of people feeling like they're not getting an opportunity to be vaccinated when they want to. So what we do is with our 2,300 vaccines each week, we administer 2,000 of them, 1,000 a day at the fairgrounds. So historically it was like Thursday and Friday, but now there's things happening on Friday. So we're going to Tuesday. So it varies, but it's 2 days at the fairgrounds at 1,000 doses each. Then we're taking 250 vaccines, and we're working with the church alliance here. They're in Daytona. So Reverend Gooden is part of that, and getting 250 of your 65 plus residents vaccinated at the Midtown Cultural Center tomorrow. And we'll do that. We'll return next Wednesday and vaccinate another 250. And then we set 50 aside for healthcare workers because, again, the allocation that the hospitals were receiving was not adequate to vaccinate healthcare workers in Volusia County. So a portion of them were vaccinated, but there's still many that need to be vaccinated. So we're trying to go about vaccine distribution in a very fair and equitable way, but with the supply the way it is and the system that's set up. So I can't guarantee that those 2,000 vaccines that are being administered at the fairgrounds are going to Volusia residents. I can't, basically I can tell you how many people in Volusia have been vaccinated, but again, they could have been vaccinated in Seminole, or they could have gone to Miami, wherever they got their appointment. So to date, here in Volusia County, we've administered 74,283 doses. And that represents 55,202 people vaccinated. Of that, 42,840, so 78% of the total people vaccinated here in Volusia County are 65 years of age and older. So we're doing a really good job. But remember, there's 130,065 and older residents, and we're at 42,000. So we still have some progress to make in reaching our probably most vulnerable population outside of the long-term care. Long-term care residents and staff were both scheduled to be vaccinated by CVS and Walgreens, and that was a national program. When I looked on Monday, all but 2 of our 140 facilities looked like the vaccinations had been administered, at least the first and possibly the second dose is beginning to happen. Another good bit of news about vaccine allocation is the federal government is allocating directly to through the federal pharmacy programs here in Florida to 3 major, in my mind, major vaccination systems, and that's Walmart, Publix, and Winn-Dixie. So I'm hoping that not only will Publix receive here in Volusia the 2,000 that comes out of the allocation for our county from the state, but they'll also get a federal allocation from the federal allocation going directly to Florida for through the federal pharmacy program. So that's good news. Again, I think it's more important that more locations offer the vaccine so that more residents can get to those locations than just like the one location out at the fairgrounds. The other piece of vaccination that I think is critical that we're beginning on Thursday is we've had some of our homebound residents contact us and say, I can't get out for a vaccine. I'm 65 and older. So we're sending a nurse and an EMT to their home to vaccinate them. And so we're compiling those names and contacts so that we're able to reach those individuals by going to their home. And until our home health agencies and other service agencies that provide services to people that are homebound, until they have vaccine, we have to really fill that gap. So that's really what public health is about, going into communities where we know individuals don't have access to vaccine and providing it. So I'm looking forward to that day where we're planning to vaccinate our farm workers in Pearson, our residents in Spring Hill, getting down to Oak Hill and those places that don't have a local pharmacy that's offering vaccines to the residents. And with that, I want to leave time for questions.
Well, I have one question because I just went out, I don't know if you guys can see me, but I got an email down at the bottom that said that you guys had transitioned, Volusia County is transitioning to a new system with the state system.
Yes.
So you want to share that with us?
Yes. So the state went into this care share system and purchased it for the entire state, for all 67 counties. So when the system was purchased, many of the counties had already figured out a way to create an appointment system and had a lot of appointments already in their local homegrown system. So they decided to stick with what they had. But over time, Department of Emergency Management has really been promoting the use of share care. And so Volusia went out to basically went over to Lake County where they're using it to see how it works. And then there's a training on Monday for the staff. And then we expect that we'll be transitioning over to this new statewide system, and it's myvaccine.fl.gov, and there's a phone number. So we expect that to happen over the course of the next couple of weeks. Right now, what it does is it's more of a pre-registration system. So it can give the state kind of a glimpse of everyone who's interested in the vaccine. In some counties, it will be their appointment system. And then counties like Volusia, where we've not transitioned yet and we're still using Eventbrite, because we never knew how many vaccines we were going to receive in any week. I mean, 1 week we received 0. We did not open up appointment systems until we knew what our allocation was, and then based the number of appointments on those days that we were vaccinating on our allocation, so that we were never promising somebody a vaccine that didn't arrive, nor were we sitting on vaccines because we didn't schedule enough appointments. So we've really done it week to week in terms of opening up appointments for vaccines. So, and there is a phone number as well as a online system to pre-register. And like I said, I would say in the next 2 weeks, we'll move into that as an appointment system as well.
Does anyone else have any questions for Ms. Boswell?
I have to say, we really had seen more cases, more hospitalizations, more people on vents in mid-January than we did this entire event. And I attribute that to the holidays.
Oh, wow.
Hi, everyone. This is Denise Vieira. I'm sorry I was late, and particularly apologize if any of this was already covered, and particularly maybe if Matt, you ask any of these types of questions, since there's a series of these conversations that were going on, and this one was somewhat targeted towards criminal justice issues. I'd be remiss if I didn't ask something that's related to that. And then I have another, well, actually, let me do the little sidebar first, because I really do want to delve into the sort of justice side of this. And that was, you made a comment about youth sports and the indoor-outdoor thing. I would think there's another dimension on that, and that is whether or not they are team or individualized sports. So I would think we'd want to kind of, keep an eye on that issue as well, and not act like it, sort of they're all the same, because, if you're doing individualized sport, you're not in close contact with people the same way. But with regard to vaccines and the justice system, you laid out, and again, I apologize if I missed something here, but kind of laid out what was going on, for example, with healthcare workers. I didn't hear anything about what we were doing, for example, with first responders. And so I'd be concerned that we have people who are out on the street, whether that not just healthcare type workers like EMT, but also police officers, who are going to be in contact with people who may be some of the most at risk or vulnerable populations in terms of potential spread, whether that is, for example, I don't need to tell you, you all know. So there's that issue. And then there's also the issue of people who are currently incarcerated, and or people who are working in places where people are incarcerated, and remembering that most people are incarcerated are coming out, and in fact, most of them are coming out really soon. So if we have, a super spreader type situation in a jail, that's then going to very quickly just get out on the street. So I'm just kind of wondering what our thinking is in terms of those spaces.
Okay, so first I'll talk to the priority groups right now. So the Executive Order 2315 actually tells providers like us who we can vaccinate, and it's the long-term care facility residents and staff, those individuals that are 65 age and older, healthcare personnel with direct patient care, which makes it a little bit tricky. And then hospital providers may vaccinate persons who they deem to be extremely vulnerable. And in our calls, they were told that they should be their patients in their brick and mortar facilities. So the governor here in Florida has decided it doesn't match up with the priority populations. If you go to the CDC website and you say who, and you look and research who should be vaccinated first, it doesn't match up because Governor DeSantis put forth this executive order. Now, the good news is on a press conference today, he talked about the fact that we're getting more federal allocation. We now have the federal pharmacy program and allocations going into Florida from that allocation. And then there's the Johnson & Johnson vaccine that's hopefully going to be approved at the end of the month. And then Pfizer has some increased production happening. So, and this was what he said during his press conference.
Just so that I make sure that I'm understanding, are you saying that you're reading the executive orders, both what's coming out of the White House, coming out of the CDC, and also what the governor has said to say that first responders are not a priority group?
In Florida, they are not the first, and he calls it the first phase. In Florida, they are not. But if you read the CDC priority groups, you will see that they are. So it doesn't match. So, but I did hear on a call with CDC this week, I believe it was CDC, that the Department of Justice and a number of other Department of Corrections and a number of other federal agencies will be pushing vaccine to their state systems. So if it's a federal prison in Florida, you may
those are state systems, so those are federal systems. So that would be the Bureau of Prisons, not the Florida Department of Corrections.
Right.
And I would think that if we're talking about what are strategies here, one of the things that we'd want to be doing is pushing back on the idea that certainly first responders that, I don't know, and maybe this is, something that Mayor, you need, it needs to be, I get the different parties and all of that, but just like that, maybe it's a more Volusia County, I don't know, something, but to really say we should have people who are dealing with patient types who are, EMTs, and that we have police officers, for example, and there's no priority there. I don't think that the governor even, does he realize that that's what he said? Because that doesn't even seem like it tracks with his own rhetoric.
Well, I would just add that Chief Young has indicated that when Halifax and Advent had their doses, they offered it to our first responders or our police, and I believe the other first responders.
Hey, Denise, can you hear me?
Mhm.
So just to jump in, first of all, I definitely appreciate your support and your stance on law enforcement being made a priority, or not just law enforcement, but first responders as a whole, because I agree wholeheartedly that first responders should be a priority, considering just the function and nature of our everyday duties and responsibilities, and the fact that we've never had the option of social distancing. That is just not an option. We have no choice but to be out there in the middle of this. But just speaking here locally, it hasn't been widely publicized, but I honestly, as the agency head, really don't have a complaint as far as the vaccinations being made available for us, because they have been made available for us. Because I've received phone calls from both Halifax and Advent saying, hey, we're going to do Tuesday and Thursday for first responders. If you can send out an email and let us know about how many of your officers are interested in getting vaccinated, and we'll make sure we have that allotment set aside for your officers to come in and get vaccinated. The thing is, just law enforcement in general, just cops, it's a very cynical group. So it's just been an uphill battle getting them to take advantage of it. Because the other thing that we're dealing with is, out of my 240 cops, the overwhelming majority are between that age range of 22 and 33. So that they believe that they're invincible anyway. So, just getting them to take it seriously, that's a battle in itself, because they believe, if I get it, I get it. I'm strong. you know, I don't have any underlying illnesses, so I'll be all right. And then you have to drill into their heads, hey, it's bigger than you. It's about your parents. It's about your grandparents. It's about the folks' homes that you're responding to. So that's just been the uphill battle, is just getting, you have the ones that believe that they're invincible. And then you have the other side that, they're just cynical and they don't trust the vaccination. They just want to hold off and wait and, just see what happens. So that's what we're dealing with. But as far as it being offered to us, again, I feel like we're blessed because it has been offered. It's been put out there, multiple times, that if we have some that want it, both Halifax and Advent both have had some set aside for us.
Denise, I don't know if I can jump in for a second and maybe answer the second half of your question at least a little bit. I know I've spoken with Director Flowers locally at the county jail level, and at least for a while, and I assume it's still in place, he had a quarantine system for new arrests coming in that allowed them to be separated from the main population for at least some period of time to try to ensure that they didn't have infections going through. Because you're right, it can be a tinderbox given how people are placed in there. I know they did have an outbreak at one time period, but it did take quite a while. They did actually a very good job considering their circumstances, which is obviously it's a big concern because almost every jail in the circuit is at a higher capacity than they would normally be in this time period. So they're certainly doing as best they can. That being said, there's the influx of people coming in and out is obviously tough to manage. And you also have the employee side where you can't, you're going to have employees coming in every single day. You either test them every single day and hope that the tests are trustworthy, or you hope that your other systems of, social distancing as much as you can. But to Chief Young's point, there are also law enforcement in there working in those jails, and they can't social distance when you're walking an inmate one place to another. At the public defender's office, I've been frustrated that we're not considered in that group because of the nature of our job requires us to be within 6 feet. If you're going to have a confidential conversation, you're going to be very close to someone, especially in an open courtroom setting. And has someone who's taken a trial during COVID, I can tell you, I was very close, shoulder to shoulder with my client. And what I saw is that, the judge can stay away, the prosecutors can stay away, the witnesses can stay away, but we can't. But unfortunately, when it's come to a lot of the things that law enforcement have enjoyed, our office has not thus far. So we're going to be pushing to help try to fix that. Thank you for that.
All right, do we have any other questions for Ms. Boswell?
And, I believe that first responders should have been at the front of the line, but I also wish we had enough vaccine to vaccinate every single individual who wanted to be vaccinated, because it's such a tremendous missed opportunity to frustrate our residents to the degree that they're frustrated by these systems of how to get the vaccine. But when you're dealing with 4,300 vaccines for a population over 500,000, and that's not counting people that come here to work or go to school and whatnot. It will take a long time, and I'm just hoping that the production ramps up so that we can at least meet the demand, and then work on the people that are, not trusting it.
Well, on that point, is there anything that needs more that any of us can be doing to, on that trust issue? Because kind of what you said, Chief, is like, yeah, you're invincible, but I'm not. So don't come to my house when there's an issue, and infect me, because I'm a little old lady who doesn't want to die.
Well, let me jump in there, because that's really where I wanted this conversation to go and to end. And I realize this is law enforcement, and I don't, when you talk about you want people to get vaccinated, obviously people have the right to refuse that. But as mayor of the city, I'm engaged in creating a campaign to promote that people do get vaccinated. And that's really the purpose of this call, is what's your advice for us on that? I've met with some people, and we're planning some tentative meetings with the county and Ms. Boswell to see if we can sort of pilot a program here in Daytona Beach called Daytona Pride, and where we take pride in getting vaccinated, where we encourage and we do things to try to dispel the myths and to bring information to the table for those who are uninformed, ill-informed, and uninspired, to do what we can to encourage them to help us collectively to be a safer community. Because right now we have a problem. And in some ways it's a good problem, is that we have less product than we, that meet the product that we have doesn't meet the demand. But eventually that's going to flip. Eventually we're going to get to a point where we don't have enough people to take the vaccine in order for us to get to herd immunity as a community and as a nation. And I want Daytona Beach to beat the curve. And our demographics in our city don't indicate that we're likely to do that, because we have a high proportion or number of people who are less inclined to get the vaccine. And Patricia shared demographics with me last week of who's that group that the chief mentions, 18 to 49, no matter what race, no matter what political party, are not going to be inspired to get the vaccine. So, a part of what we're doing, and I've raised some private dollars, I would like to use public and private resources to basically execute a campaign that uses yard signs, that uses buttons, that uses PSAs, that uses commercials, billboards, internet or social media campaigning. We will need younger people to embrace the campaign, to say, I got the vaccine, this is why. I mean, and me knowing that I was going to be working on this a long time ago, and I've said this to other groups, was a large part of the reason that I was vaccinated early. I can say, and I've said this to a lot of people who have already changed their minds about getting vaccinated, because I can tell them about my experience, and I can share with them about how I felt. Both of my parents have been vaccinated, and I can share their experiences from a senior citizen's perspective, and I want them to help promote, but I need every voice that's willing. So I guess the question now is, and one of the things we don't want to do is to frustrate people by saying, get vaccinated, and then we don't have enough of the product. But I want to have a plan in place, and that's why we're working on this plan, so that we can start to roll it out to create this momentum so that our community will not hopefully be behind. And Ms. Boswell is excellent at trying to be equitable about things and recognizing the challenges in Daytona Beach. You'll remember that Daytona Beach was the first city to have testing. We were the first city to vaccinate people, in large part because she herself understands the demographics and the inherent inequities that are experienced by the people who live here. So my question for you all is, what are some ideas that you have in support of how we can encourage, and that's not to put you all in awkward positions, because I realize how people feel about someone telling them to get vaccinated. And me as a mayor, I am a mayor, but I have to be careful, because the last thing that a lot of people want to hear from is this feeling that the government is trying to make me get vaccinated. So I'm very careful to that.
Yeah.
And I want to be very sensitive to that, but I do want to hear from you all.
Mayor Henry, if I could jump in real quick, I would bring up 2 points to that. The first would be, I think you obviously need to meet people where they are, but most importantly, meet the misinformation where it is. When I pull up my Facebook feed, I see an article about how one person died within 5 days of getting the vaccine, maybe over in Minnesota. Or I see an article about how maybe it's possible someone with a vaccine might be able to reinfect someone else. And what I'm not seeing is the commentary from someone like Denise, who's saying, who has Chief Young show up at her house and go, when she is an emergency, she can know I'm safe for her. Because even though I'm not worried about my safety, I'm here. I got vaccinated for her. And so our messaging, I think that second point is the messaging isn't you need to do this for you. It's you need to do this for us. You're protecting your grandma. Your shield doesn't protect your own health. It protects the health of everyone else. And that I think when we switch around the messaging, instead of we're forcing you to do this, we're asking you to serve your country, to serve your friends, to serve your people by being the safety, so that when one of the officers needs to come in, they don't have to worry about being an asymptomatic carrier to the next person that they have to go see. So that would be my 2 cents.
And I would just build on that, Matt, by saying that even with, it's not just, for example, even with first responders, it's any business, right? If you got a sign in your window that says, everybody who works here has been vaccinated, that's where I want to go. That's the restaurant I'm going to, right? That's the store I want to go back into. That's even the bar, even though that doesn't mean everybody at the bar is actually vaccinated. But, like you start to say, that's the environment we're creating here. So as in my space, whatever that is that you have a little bit more, kind of control it, but saying that to certain businesses, hey, if you can get your employees to do that, I don't know if there's any kind of incentive we can create around that, but I would think just business as an incentive, even if it's just the publicity, sign in the window that says, this is a place where everybody who works here has been vaccinated. I would think that might drive some business there.
What about the summer concert series? The first one is for people who have been vaccinated.
Right. But so this idea, you're doing it for other people, right? Like Matt said before, but then also if you can get everybody in some place who's done it, then that's, I don't know, for me, I would be more inclined to do that. And then, like you said, the visibility stuff of, whether that's just, button stickers or hey, I've been vaccinated. It's like the I voted kind of stuff, letting people know that, oh, I'm the outlier. Everyone else is getting vaccinated, I think is helpful too. But obviously you have that on the radar screen, just from the idea that you're saying lawn signs and buttons, you're already thinking, in that way. So.
Mm-hmm. Well, I really like that idea of saying, we have embraced being vaccinated as a business so that you will feel safe coming here. And I like that. Other thoughts?
Yeah, I'm thinking about, I've been thinking about some form of a PSA that focuses specifically on COVID survivors, those that may not be seniors, but they got hit with this thing and, they didn't know if they were going to make it or not, because there's several of them out there, a lot of them right here in the city, that they're not that old, but they came close to being on a ventilator. And then they survived. By the grace of God, they pulled through and they made a recovery. When you talk to those folks will tell you, had I had a chance to get vaccinated to avoid going through what I went through when I caught it, I would have gotten vaccinated. I'm even thinking about, I don't know if he would be willing to do it, but like Ralph Walton, Norma Bland's son, getting Ralph on board saying, I lost my mom right here in this community to COVID-19. Norma was doing her best to be cautious. Norma wouldn't even come out for any of the marches or anything going on after George Floyd. She talked to me, but she said, I can't come out there, baby, because, I don't want COVID. I can't catch the coronavirus. And somehow she still ended up getting it. And ultimately it cost her life. Getting those family members involved that have lost people to COVID, having them be a part of the PSA, saying, look, even if it's not for you, it's for your family. You don't want to go through what we went through, to where we couldn't even say goodbye to our loved ones because of COVID-19. pulling at the heartstrings of people. That's just my thoughts on it.
Okay, great. Anyone else?
You know, when you were talking earlier about resuming that normal activity, you know, the focus on if we can all get vaccinated, we'll be back to playing bridge together. We'll be back to watching our kids outside playing sports together. That, you know, the things that we're missing, we want to resume those activities again, and vaccination will help us get there if all of us get vaccinated. Not 10 of us, but like you mentioned, that herd immunity that we have to get to.
Okay. Excellent suggestions.
I like the idea. I just want to throw something into what Patricia said, the idea of like the sort of what do you miss? Because it also then connects with what Chief Young was saying. It's so like, you know, it's not just, oh, get back on, it's like, what do I miss? That kind of a campaign on, you know, I miss socializing with my friends. I miss, you know, being able to go to church. I miss being able to go to school. Can't believe kids are actually saying that now, right? I miss my mother, you know, that those are, I mean, I think there's multiple ways that, and I know, you know, that exact message may not be tight enough, I miss, but something that pulls across multiple, you know, that can go across different ways of looking at things, both people that I miss, activities that I miss, a business person saying this is, you know, we missed our customers or whatever, something like that, I think, but some consistency in that. And I know you had better PR people than me who can come up with.
Well, not really any better than these ideas. These are the best that I've heard throughout the whole, all of my sessions. And that's just being real. These are great ideas.
We just had more time.
Anyone else? I'm going to conclude with concluding comments from anyone. It's good to see you on here, Dr. Wilson. I see Joe Magillo on here as well. So if anyone has any concluding remarks just as it relates to COVID, how we can promote vaccinations in our community, or any other thoughts surrounding equity, it would be appreciated. Patricia, you're in the left-hand corner.
Well, I just want to thank you for this opportunity. I really enjoyed being part of all the focus groups, and your health department is here to help through this. It's almost a year, and it's been a very long year, I know, for everyone in the different roles that you have. And I think Volusia has done an extraordinary job in, you know, we've not contained it, but we've slowed the spread in many instances. So thank you for all the efforts that everybody has made in working together on this. Thank you.
Thank you. Denise?
I think I've run my mouth enough. Thank you all for the great work that you do. And if there's any way that I can help, let me know.
All right, thank you. Dr. Wilson?
I am good. I'm just enjoying the great conversation and hearing what's going on. So hats off to everyone for doing a great job.
Okay. Thank you, sir. Chief?
I think I'm good as well. I just appreciate the opportunity and look forward to, you know, coming together on whatever is decided to get the word out.
Okay, thank you. And I will be calling upon you. Matt? I have a hard time not referring to you in a more professional way, but, you know, anyway, go ahead, sir.
All right. No, just appreciate it for your time. I think focusing on branding and really getting the message to the people, social media and where they're congregating, you know, even Bike Week itself, letting our vendors know that, you know, you can be a safer vendor as vaccinated. I think things like that are very important.
Ms. Davison?
It's funny hearing you say to me in a professional manner.
That's why I did it.
But no, I'm good. I just appreciate the conversation, and it's good to hear that people are actually, you know, taking it serious and trying to get the word out and whatnot, not just like, oh, I'm sick of this and I'm over it, but actually trying to do something about it.
All right. And Joe, I know you're there. I see you, so I don't know if you had anything to add. I'll take that as a negative. We'd like to keep these calls to right at an hour and 15 minutes. So I thank everyone for your time tonight. I want to encourage you all to continue to embrace the idea of making Daytona Beach a paradigm or model for equity. That is the overall agenda that I'm on, and I just appreciate y'all's call. So joining the call. Good night to one and all.